Bismillahirrahmanirrahim. This video will describe the process of wound healing. These are the references for this video. Here, this image presents a beautifully structured visual summary of the sequential stages of the wound healing, breaking it down into 7 key phases, each with its key process and cellular players. First it is the vascular response that involves vasoconstriction. That is, there is presence of leaky vessels, edema, transudate or exudate formation, and activation of the platelets. This phase limits blood loss and initiate the hemostatic response. Then the coagulation starts and the clot formation occurs with the provisional matrix of fibrin, fibronectin, and wall-Wienerbrand factor. The platelet release vasoactive mediators, growth factors, and cytokines to recruit more repair cells. Then there is inflammatory response with granulation tissue formation. There is recruitment of leukocyte, release of cytokines, chemokines for debridement of the bacteria and debris. Neutrophil and macrophages dominate in the early process, and there is promotion of angiogenesis, that is the formation of new blood vessel, and this is supported by pericytes and basal laminae. Then the remodeling or fibrosis occur. Here new capillary formation, and many of these may resolve. There is production of collagen 1 and 3 by the fibroblast, and also proteoglycans are produced. Macrophages secretes proteinases and growth factor, and there is transition of the tissue toward the scar formation. There is resurfacing of the epithelium, and in this phase the keratinocyte migrate over the basal lamina. They restore the epidermal barrier, completing the reepithelialization. Then sixth phase is characterized by wound contracture. Here the myofibroblasts assemble actin fiber, apply tension on the collagen, and cause scar contraction that potentially distorts the scar. Then scar remodeling occurs, and this is the final strengthening phase that involves the tensile strength increase, collagen turnover. There is loss of collagen 3 and matrix metalloproteinases, and type 1 collagen is now formed by the fibroblast. So this is how the dynamic and well coordinated biological orchestration behind the wound repair occur, and this knowledge is essential for the fields of surgery, dermatology, and pathology. So beside the inflammation, three important mechanisms that are involved in scar formation are angiogenesis, granulation tissue formation, and remodeling of the connective tissue. The All of these are sequential steps. First one of these is angiogenesis, that is the formation of new blood vessels to supply nutrients and oxygen to the area to support the repair. And this activity is driven by vascular endothelial growth factor, that is also known as VEGF. And these newly formed blood vessels are leaky due to incomplete endothelial junction and VEGF-induced increased vascular permeability. This leakiness explains the persistent edema in a healing wound even after inflammation subsides. Then the another one is the formation of granulation tissue. It is the migration and proliferation of the fibroblast, deposition of loose connective tissue, and sprouting of new capillaries with interspersed leukocytes. Grossly, they appear as pink, soft granular tissue when seen under a skin wound scab, and histologically it is composed of thin-walled delicate vessels, fibroblasts, loose extracellular matrix, and macrophages. This granulation tissue appear by 3 to 5 days after the injury. The extent of the presence of this granulation tissue depends on wound size and intensity of the inflammation. The third step in the scar formation is connective tissue remodeling. This is maturation and reorganization of granulation tissue into fibrous scar. By increased deposition of the connective tissue, a scar becomes more stable and organized over time. So, the key role of macrophages is responsible for most of these activities. They clear off offending agents and dead tissue and provide growth factor for fibroblast and endothelial cell proliferation. They also secrete cytokines that stimulate fibroblast proliferation and matrix production. Alternately activated macrophages or M2 macrophages dominate the repair process and they replace M1 type of the macrophages. So the fibroblast migration to the site of the scar, it occurs within the 24 hours. So to summarize, three steps are angiogenesis, formation of granulation tissue, and remodeling of the connective tissue. We have seen all of these videos of remodeling of connective tissue and constituents of the connective tissue in previous videos. Then to remember the timeline that these fibroblast and endothelial cell proliferation, it occurs within 24 hours while the granulation tissue is formed within 3 to 5 days. So this is a normal muscular tissue example of a muscular tissue. As you know, the muscular tissue has got limited regenerative capacity. There is first inflammation at the site of the injury, which clears off the dead cells and microbes. If there is any, there is extensive inflammation, and debridement of this site is done by the action of the cytokines and various cellular products in the area. Then granulation tissue is formed within the stipulated period 3 to 5 days, and finally there is initiation of scar formation. Thank you for watching this video. If you have any query, please write in the comment box.